Hello, it's Dr. Erica. Thank you finally for joining me on this particular video. I'm talking about a medication recently approved by the FDA. We received approval this month. Thank you for joining me. I'm Dr. Erica Onibola, pharmacist for close to 10 years now, owner and operator of Millennium Pharmacy. So please do visit my website and also subscribe to this channel to learn more about upcoming FDA approvals and my advice on different medical topics. And also, please like, share, subscribe, comment, leave topic suggestions if you would. I'm Dr. Erica. Thank you for joining me. Stay tuned to the end of the video. Hi, I'm Dr. Erica. This is a new video about a new diabetes type 1 medication that helps patients who are dealing with type 1 diabetes. Type 1 diabetes is a disease that starts early in life. It usually starts with young children, teenagers, and early adulthood, but usually it occurs in early life, and patients do not produce enough insulin to fight off sugars and fight off glucose that they receive from their meals. And because of that, these patients have to be given insulin on a regular basis. Daily, they have to consume insulin products and also tablets, but mainly it's going to be insulin that they receive from injections or insulin from the continuous glucose monitoring. And then also there is new products that are available. One of those new products that I'm going to talk about is called CELLTRANS, which is a new pancreatic cell infusion. And it's a one-time, usually, injection. And this particular item is going to be infused. It's going to be done in the doctor's office, and it's going to be done very, very strategically, and it has been done already. And so, because of the research behind the evidence, because of the trial that actually put forth for approval for the medication to be used, it is now FDA approved, and we are proud of that as healthcare providers, as pharmacists. Now, my advice would be that if you are someone who's recently diagnosed and can afford the cost of the procedure and have tried other insulin products, or may not have tried insulin products and want to give this a try, then I would suggest that you try it out. However, someone who has been on insulin and who is stable on insulin products and can continue to utilize insulin safely and effectively, then I would continue doing just that. Now, this product that is new on the market called CELLTRANS is going to be pancreatic cell. The pancreas is the organ system that's located in the torso of the body that produces insulin from beta cells. Beta cells that do not produce insulin are no good, and so that this product is a transfer of beta cells from dead donors to patients. Once the donor is considered a dead donor, that donor still have pancreatic beta cells that do work. And because of that, doctors are able to go in and extract those cells from the dead donor to the new patient. Now, that is something that has been approved using a non-randomized trial where most of the patients, or most of the type 1 diabetic patients, did receive at least one injection and they were successful, or they received up to 3 injections and were successful. Most of the patients who received an injection during this particular non-randomized trial, they did find out that most of the patients were insulin independent after receiving beta cells from the dead donors for at least 1 year. At least 1 year. Most of them, for 1 year, were able to not have to need any type of insulin medication because these pancreatic beta cell transfers were successful. Now, after that, some people were even better off after up to 5 years. Some people were insulin independent for up to 5 years, and they did not require any type of whatsoever insulin. Now, there was a smaller group of patients who were able to exceed those 5 years without being insulin dependent. So this is a very effective procedure and FDA approved medication. Again, I would recommend it for someone who is newly diagnosed with type 1 diabetes and would like to try it out and can afford this particular procedure. And they are eager to be insulin independent without any daily injections, without the monitoring of glucose and all of that throughout the day. This will allow that freedom. And I do suggest it just for that particular population, those newly diagnosed type 1 diabetes, those who are stable on insulin already as type 1 diabetes, I would not maybe suggest it until maybe later on. But again, if you're safe and you're stable on your medications, then I would suggest maintaining where you are with your medications. So that is my advice from Dr. Erica, pharmacist, PharmD. Check with your actual healthcare provider to learn more and know what's specific for you and what is most safe and most effective for yourself. Okay, so thank you for joining me on this particular video. Please like, share, and subscribe. I'm Dr. Erica. Take care. Bye-bye.